Planned Parenthood Association of Ghana, PPAG, a non-governmental organization, is appealing to government to integrate its comprehensive sexuality education manual for young people into the curricular activities of students from basic to senior high schools. Speaking at the launch of the Know It, Own It, Live It CSE manual for young people in Accra, Programs Coordinator of the Association, Ishmael Kweku Salasi, says the rationale behind the manual is to bridge the gap in the curriculum activities in schools. The youth, he says, are not given comprehensive information on sexual reproductive health, abortion, use of contraceptives, contracting diseases, among others, hence the increasing rate of early childbirth.
Challenged as a people in addressing the sexual and reproductive health questions that young people have. And it is partly because of our cultural values, it's partly because of our religious practices, it's partly also because of our belief systems and the way we've grown up. It is very difficult for parents to talk about sex and sexuality with their kids. But what we are emphasizing is that even as early as 5 or 6, you can deliver sexuality education for your child. At that early age, you are starting to talk to the young person to know that his private part is private, not accessible to anybody else. That is critical information. That information will save that little boy or girl from a pedophile. Because if an external person is attempting to access his or her private part, he or she would insist that it's my private part. Nobody is allowed. That is part of comprehensive sexuality education.
And on her part, Deputy Education Minister Barbara Isi Acha says parents should protect the rights of children by helping them build self-confidence in order to become competitive in the world.
There is no doubt that our human capital is our biggest resource that can propel our development agenda. And that human resource flows from an educated, competitive, and vibrant workforce. But so long as we continue to see high school dropout rates, especially among young girls of school-going age as a result of pregnancies, then this will only remain a dream. We need a committed people and institutions that will drive this, ensure our children are fully prepared for the future ahead of them. We need to step up the support we provide to our children to learn about themselves, know how their bodies function, and decisions to make to ensure their well-being and development at adolescence and beyond. We must confront our social-cultural practices and values that draw us back and transform these into progressive practices, values, and beliefs that help to position our children in the right frame of mind, liberty, and freedom to explore, learn, and take charge of their world. Until we do this, we will continue to groom a population that is timid, retired, and non-competitive.
According to Country Director at the Mary Stopes International, and calling parents and teachers do not explore the context and meanings involved in sex for fear of the youth engaging in it. The country, she says, must not shy away from sharing the very information the youth needs in order to secure them better health and a brighter future.
Teenage pregnancy rate is at 14%, which means that 1 in 7 girls get pregnant before they are 20. Furthermore, there's 50% of unmet need for family planning for those between 15 and 19 years old, leading to a high number of unwanted pregnancies and its potential negative consequences. Thirdly, adolescence is the period young people establish habits which often last a lifetime. Sexual and reproductive health and rights are a cornerstone of young people's transitions to adulthood, influencing outcomes for the future to come. Therefore, we need to provide them with adequate information to ensure those habits are right from the start. Literature is replete with evidence that comprehensive sexual education helps in delaying sexual debut among young people, reducing unintended pregnancies, improving negotiation skills of young teenage girls, improving self-esteem, and assertiveness, and reducing the number of sexual partners and increasing contraceptive use among adults. It represents a bold step forwards to improving the quality of sexuality information available to our young people, as we seek to enable them to make informed decisions and also improve their sexual health behaviors.